Bruno Gualano. I'm Associate Professor of the School of Medicine of the University of São Paulo, Brazil. In my talk today, we will cover the effects of creatine supplementation and exercise training for patients with type 2 diabetes. My disclosures, and this is a brief outline of the presentation. I will very briefly cover the effects of creatine supplementation on carbohydrate metabolism, and then I will move to the trial that it did in Brazil on creatine supplementation type 2 diabetes. I will show you some results on the efficacy of creatine, its underlying mechanisms, and some safety parameters as well. And then I will finish off with some gaps in the literature. So we know for a very long time that creatine supplementation can modify glucose metabolism. For instance, we know that creatine supplementation can reduce glycemia in dogs. We also know that when combined with exercise training, creatine can enhance glycogen accumulation in humans. Creatine can also increase GLUT4 expression in healthy individuals, and data from our lab show that creatine supplementation also in humans can improve glucose tolerance in young healthy individuals. So this is pretty much the rationale for hypothesizing that creatine supplementation could act as a insulin sensitizer. We also know that exercise training can improve insulin sensitivity, lipid profile, body composition, and glycemic control in patients with type 2 diabetes. Therefore, we decided to study the combination of these two strategies in order to benefit patients with type 2 diabetes. We also investigated the effects of creatine supplementation in kidney function, especially. So here we were interested in side or adverse effects of creatine supplementation. This was a secondary outcome in this study. So the main objective of this trial was to investigate the efficacy and safety of creatine along with exercise training in patients with type 2 diabetes. We conducted a 12-week randomized controlled trial. Patients were selected if they used metformin and sulfonylurea, if they had glycate hemoglobin less than 9%, if they had glomerular filtration rate above 30, if they were older than 45. So patients were given either creatine or placebo in a double-blind fashion, and they were submitted to an exercise training program. So before and after 12 weeks, we assessed as the primary outcome glycate hemoglobin, and also several secondary outcomes, including insulinemia, glycemia, lipid profile, physical capacity, and functional data. We also assessed body composition by DEXA, liver function, and like I said, kidney function by means of several markers, especially EDTA clearance, which is the gold standard technique for assessing, for measuring kidney function. We also assessed dietary intake by 3 food records. We assessed phosphorylcreatine content using MRS, and by means of muscle biopsies, we assessed GLUT4 protein expression, total as well translocation, and we also assessed AMPK protein expression. So let me show you some results from this trial. As you can see here, this is data from baseline. It's possible to note that both groups were quite similar in terms of general characteristics. Creatine was able to increase phosphorylcreatine content, as you can see here in the black bar after the intervention. And we also observed that creatine supplementation was able to improve glycate hemoglobin when compared to placebo. Here we have some data from the meal tolerance test, glycemia data specifically. It's possible to see that after the intervention, the creatine group presented with lower levels of glycemia as compared to placebo. And here we have the area under the curve for the creatine group as compared to placebo. So clearly there was an improvement in the creatine group. We did not observe any change in GLUT4 content after the intervention. Here we have in the dotted line data from health individuals as a reference. But we did observe a greater increase in GLUT4 translocation in the creatine group as compared to placebo. This is an effect that could be attributed to creatine. Interestingly, we also observed greater increase in AMPK content after creatine supplementation, and changes in AMPK were associated with greater GLUT4 translocation, and also changes in AMPK were associated with improvements in glycate hemoglobin. In this trial, creatine supplementation did not change insulinemia, C-peptide concentration, HOMA and GI index, lipid profile, lean and fat mass, and all functional parameters. So we can speculate that creatine supplementation itself could retain water, and this could activate osmosensing genes, which in turn could lead to GLUT4 translocation and consequently improvements in glucose uptake. We believe in this study that the effect that we saw could be attributed to the combination of exercise training and creatine. So creatine could have improved the adaptations of exercise in these pathways, enhancing the activation of GLUT4 translocation and also improving the uptake of glucose. We observed that creatine supplementation did not cause any damage in kidney function. Here we have data of proteinuria and albuminuria, individual data. And even for those with albuminuria before the intervention, creatine supplementation did not exacerbate this condition, as you can see here. When you look at the DTA clearance, we can observe the same tendency. That is, creatine supplementation did not change, did not impair kidney function in these patients. Let's look at the individual data here. It's possible to see that creatine supplementation did not lead to any substantial reduction in kidney function in these patients. In addition, creatine supplementation did not change its sodium, potassium, urea, creatinine clearance, did not change as well liver enzymes, and we did not see any other adverse events that are commonly attributed to creatine, such as muscle cramps, GI distress, myalgia, and so on. So this is where we started. We presented this data. I had the privilege to present this data in the Creatine Conference in Cambridge in 2010. We had lovely discussions about the potential of creatine supplementation in improving glucose metabolism. I remember that Paul gave us a very interesting lecture on the potential of creatine supplementation in benefiting patients with type 2 diabetes. But unfortunately, we did not have much advance since then. So after this exploratory trial that I just showed you, we did not have many data to confirm or to refute the data that I just showed you. So in fact, we have several gaps in this field. We usually need more studies in order to confirm if creatine could be used as a adjuvant in the management of type 2 diabetes. We need studies with larger sample size and also with longer term follow-ups. We still don't know if creatine supplementation per se can increase GLUT4 translocation, or if it is necessary to combine creatine with exercise training to see this effect. In terms of safety, it's very important to expand the samples, to have more heterogeneous patients, especially those with pre-existing chronic kidney disease under creatine supplementation, to confirm that creatine is safe for this very specific population. So, in order to answer this question, can creatine be used as part of treatment in type 2 diabetes? We need more trials. This is the main conclusion of this presentation. So with that, I'd like to acknowledge the participation of important contributors for this trial and others that you were able to conduct during 15 years involving creatine supplementation in our lab. This was just possible thanks to these people, and also grants from companies and agencies in Brazil that support research. Thanks so much for your attention.